Good morning, afternoon, or middle of the night, depending on who you may be listening. We'll be talking about nursing considerations for drugs that treat epilepsy, Parkinson's disease, and Alzheimer's. This group consists of Lacey, Alicia, Ellen, and myself, Brooke. First, we will talk about drugs to treat epilepsy. These classes include hydantoins, barbiturates, and drugs to treat status epilepticus. The hydantoins we are going to discuss are Peganon, Cerebix, and our prototype Dilantin. One good thing about the hydantoins is that they all end in toin, which is great for those of us who still have to study for the other 5 tests and can't pronounce these drugs anyway. So we're focusing on nursing considerations, and one very important thing for we nurses to know is that Dilantin has a very narrow therapeutic index. Its range is 10 to 20 micrograms per milliliter, and brand can be very important. As for the rest of the hydantoins, they should not be used in, wait for it, pregnancy, lactation, or, shocker, allergy. Like most other drugs, they should be used cautiously in elderly patients, patients with renal or hepatic dysfunction, and diabetic patients. Side effects to be aware of are drowsiness, fatigue, constipation, dysrhythmias, anorexia, sexual dysfunction, and gingival hyperplasia. Because of these, we need to teach our patients about good oral hygiene. They need soft bristle toothbrushes, and they should avoid alcoholic mouthwashes. In fact, they should avoid all alcohol. These patients need to be taught not to stop the drug abruptly because it can increase seizure activity. The CBC also should be assessed before and during treatment to check for bone marrow suppression. Another side effect to note on Dilantin is that for women of childbearing age, it can affect your birth control. So if you are on birth control, you're going to need to speak to your provider about that. In addition, although it should not be used in pregnancy, it is occasionally still used if the risk to the mother for stopping outweighs the risk to the fetus. As for the barbiturates, these mainly end in barbital. The drugs most commonly used are methylbarbital, phenobarbital, and primidone. These are known for causing CNS depression, so we need to be especially careful to monitor for that, and of course, check which of the patient's other drugs may cause CNS depression. The contraindications and cautions are the same as in the hydantoins, mainly being pregnancy, lactation, and allergy. Some side effects we will need to watch out for are dysrhythmias, anorexia, dry mouth, sexual dysfunction, hypnosis, sedation, urinary retention, blood pressure changes, and constipation. In relation to those, we may want to monitor INOs on our patients to check for retention, as well as asking the doctor about a stool softener or a laxative to alleviate constipation. These drugs also should not be taken with alcohol, and the patients on them shouldn't be driving. One big thing we need to assess for with barbiturates is sexual dysfunction. Because it may be an embarrassing topic, patients may simply stop taking the drug and not speak with their provider first. Stopping these drugs abruptly is very dangerous and can lead to an outburst of seizure activity. For both of these and the hydantoins, we of course need to implement seizure precautions, which includes patting the side rails of the bed and keeping suction equipment ready. As for status epilepticus, mainly it is treated with benzos such as Valium. However, it can be treated with increased doses of Cerebrix and Luminol. Okay, time to wake up. We have a pop quiz about the medications we just went over. Question 1. The home health nurse visits a client who is taking Dilantin for control of seizures. During the assessment, the nurse notes that the client is taking birth control pills. Which information should the nurse include in the teaching plan? 1. Pregnancy should be avoided while taking Dilantin. 2. The client may stop the medication if it is causing severe GI effects. 3. There is a potential of decreased effectiveness of birth control pills while taking Dilantin. Or 4. There is an increased risk of thrombophlebitis while taking Dilantin and birth control pills together. The answer is 3. There is a potential of decreased effectiveness of birth control pills while taking Dilantin. Question 2. The nurse has given medication instructions for the patient receiving Dilantin. Which statement indicates the client has an adequate understanding of the material? 1. Alcohol is not contraindicated while taking this medication. 2. Good oral hygiene is needed, including brushing and flossing. 3. The medication dose may be self-adjusted depending on side effects. Or 4. The morning dose of the medication should be taken before a serum drug level is drawn. The answer is 2. Good oral hygiene is needed, including brushing and flossing. Here are the rationales for question 1 and 2 that you can review at your leisure. Moving on to drugs that treat Parkinson's disease, we have Sinemet. Now, patients with Parkinson's will display a shuffling gait, mask-like expression, tremors, and slow and slurred speech. Some adverse effects of Sinemet to monitor for and educate the patient and the patient's family about are flushing, urinary retention, dry mouth, physiological symptoms and behavioral changes such as depression, suicidal thoughts, mood changes like aggression and confusion, dysphagia, hypotension, and with long-term use, dyskinesia. The treatment is aimed to reduce the symptoms. The patient should try to remain as active as possible, perform their activities of daily living, and they may feel tired, so it is important to space activities out and rest in between. It is important that the family understand the medications as they are prescribed, the dosage, frequency, and the adverse effects. In addition, the patient may need support mentally. Provide material for support groups the patient may wish to attend. As for nursing considerations, when the patient starts the medication, vital signs should be taken, especially the blood pressure. If the dose changes, also monitor the blood pressure because hypotension may occur. In addition, monitor for orthostatic hypotension. Educate the patient and family that while changing positions, it should be done slowly. Monitor for overdose signs and symptoms, which include muscle twitching and bronchospasm. Patients who have diabetes are at risk for poor controlled glucose and are at risk for hyperglycemia. If the patient is displaying signs of urinary retention, have the patient void prior to administration. Monitor urine output, and if necessary, palpate the bladder to check for retention. Labs to monitor include liver function tests, renal tests, and hematological tests. These include AST, ALT, BU1, creatinine, GFR, and white blood cell count and red blood cell count. As for patient education, when a patient is prescribed levodopa/carbidopa, also known as Sinemet, there are food interactions that the patient should be aware of. A high protein consumption of B6 decreases the effectiveness of the medication. The patient should take these medications on an empty stomach, avoid high protein meals, and avoid consumption of B6, such as bananas, green vegetables, liver, or legumes. Also, multivitamins containing B6 should be avoided. Drug-related changes include dark urine and perspiration, which is a normal finding. Continuing on with patient education, these medications may take several months for their full effect. They are also only effective for 2 to 5 years, and during that time, it is possible for a need to increase the dose. It is important for the patient to take the dose as scheduled because stopping the medication abruptly can cause a Parkinsonism crisis, which is a sudden worsening of akinesia and motor symptoms. Here is a quick quiz on Sinemet. Carbidopa-levodopa, also known as Sinemet, is prescribed for a client with Parkinson's disease. The nurse monitors the client for side effects to the medication. Which finding indicates that the client is experiencing an adverse effect? 1. Pruritus. 2. Tachycardia. 3. Hypertension. Or 4. Impaired voluntary movements. The answer is 4. Impaired voluntary movements. Here is the rationale to question 3.
Hi everybody, this is Ellen Berry. I will be narrating the section in regards to Alzheimer's disease. Alzheimer's disease is specifically close to my heart because my grandfather was unfortunately diagnosed back in 2002 and passed away about 5 years later. This is a horrific disease that not only takes a toll on the diagnosed but on the family members as well. Alzheimer's is a chronic progressive disease in which the patient slowly loses memory and the ability to perform activities of daily living. It becomes difficult to speak, to problem solve, and to regulate their mood. It also has some physiologic damage. There are many drugs used to slow the progression of this disease since there is no known cure. The drug I will be focusing on is called Namenda, which was put to market in 2003. The way Namenda works is by blocking receptor sites in the brain that prevent the buildup of plaque, which in turn slows the progression of the disease as well as helping reduce mild symptoms. Therapy involves starting at a 5 milligram per day, and you eventually work up to 20 milligrams per day through 2 10 milligram doses. Some things to remember is that if a patient has renal impairment, the need for decreasing the dose may be needed. Some important adverse effects include headache, dizziness, fatigue, confusion, and constipation. So as you can see, some of the symptoms kind of reflect the symptoms of the actual disease of Alzheimer's. Some nursing points to consider include not taking this medication with anything that alkalinizes the urine. Sorry for my stumble. There must also be an emphasis on the fact that this medication will not cure the disease, but merely help slow the progression and reduce mild symptoms. Also, with a patient with heart disease, monitor their respiratory and cardiovascular status. This medication may cause bradycardia, so that's important to monitor for. It is also important to bring the patient or delegate to a UAP to bring the patient to the bathroom every 2 hours because this medication can increase urination. There is also an increased risk for GI bleeding if they're taking NSAIDs. We also must be careful to monitor their hematocrit and hemoglobin levels because the medication may cause anemia. Some important patient education, again, is to emphasize that this medication does not cure Alzheimer's, but merely slows the progression and helps reduce mild symptoms. It is also important to talk to the patients about supportive services for the family members as well as the patient who has been diagnosed. This medication can be given with or without food and must be taken as prescribed. It is very important for the patient or the family members to report any of these following signs to your healthcare provider. If they have a very slow pulse, lightheaded, abdominal cramping or pain, weakness or confusion, blurring of vision, or they notice further signs of dementia. The antidote for Namenda is atropine sulfate. I hope you enjoyed our lecture and have a great day. Good luck on your HESIs and finals.